Did you know that over 5.4 million cases of skin cancer are diagnosed every year in the US alone? That's more than all other cancers combined. But what's even scarier is that skin cancer often starts as something small and unnoticeable, a tiny bump, a rough patch, or a spot that looks like nothing more than an ordinary wart. Many people ignore these signs, assuming they're harmless, but by the time they realize something is wrong, it might already be too late. So, how can you tell if that strange bump on your skin is just a wart or something far more dangerous? Well, in this video, we will dive into everything you need to know about warts and skin cancer, what causes them, how they actually look, how they progress, and most importantly, how to tell them apart before it's too late. So, without any further ado, let's get started. What are warts and what they look like? Warts are simply small, rough growths that occur when the human papillomavirus, HPV, infects the top layer of your skin. While they might look concerning, they're typically harmless. The virus enters through tiny cuts or breaks in your skin, targeting the cells and causing them to multiply rapidly, creating that characteristic raised growth we recognize as a wart. These growths usually appear flesh-colored or slightly grayish brown, with a distinctive rough, grainy surface that can feel bumpy to the touch. One telltale sign of warts is the presence of tiny black dots within the growth. These are actually small blood vessels that have clotted. While warts commonly appear on hands and fingers, they can develop anywhere on your body, ranging from tiny pinhead-sized spots to growths as large as a dime. Causes of warts. The virus responsible for warts spreads primarily through direct contact. You might catch it from touching someone else's wart, or from surfaces where the virus lurks, such as shower floors or pool decks. People with compromised immune systems face a higher risk of developing warts, as do those who frequently bite their nails or have numerous small cuts on their skin. Children and teenagers are particularly susceptible due to their still developing immune systems. Treatment for warts. When it comes to treating warts, you have several options depending on the wart's size, location, and stubbornness. Over-the-counter salicylic acid treatments work by gradually peeling away the infected skin, though they require consistent application over several weeks or months. For faster results, doctors can perform cryotherapy, literally freezing the wart with liquid nitrogen. This treatment, while briefly uncomfortable, effectively destroys the infected tissue. More stubborn warts might require prescription medications, laser treatment, or even surgical removal in rare cases. One of the biggest challenges with warts is that they often come back because the virus remains in the body. Boosting the immune system and avoiding direct contact with infected surfaces can help prevent new warts from forming. What is skin cancer and what it looks like? Skin cancer is the abnormal and uncontrolled growth of skin cells forming a mass or tumor. There are 3 types of skin cancer, each with its own distinct characteristics and levels of severity. Understanding these differences is crucial for early detection and treatment. Number 1. Basal cell carcinoma, BCC. Basal cell carcinoma develops in the bottom layer of your epidermis, where new skin cells are constantly being created. It's the most common form of skin cancer, accounting for roughly 80% of all cases. BCC typically appears as pearly, waxy bumps that might be flesh-colored or slightly pink. Sometimes they present as flat, brown, or flesh-colored patches that look similar to a scar. A key warning sign is when these spots repeatedly bleed, scab over, heal, and then start bleeding again. The primary cause of BCC is cumulative UV exposure over your lifetime, particularly if you've had severe sunburns. While it rarely spreads to other parts of your body, BCC can grow deep into your skin, causing significant damage to surrounding tissue and even bone if left untreated. Treatment usually involves surgical removal, either through standard excision or Mohs surgery, where the cancer is removed layer by layer while preserving as much healthy tissue as possible. Number 2. Squamous cell carcinoma, SCC. Squamous cell carcinoma develops in the upper layers of your epidermis and presents a more serious threat than BCC. These cancers often appear as firm, red nodules or flat lesions with scaly, crusted surfaces. They frequently show up on sun-exposed areas like your face, ears, and backs of hands. Unlike BCC, squamous cell carcinomas can grow more aggressively and may spread to other parts of your body if not treated promptly. They're particularly dangerous when they develop on your lips, ears, or in immunocompromised individuals. The treatment typically involves surgical removal, though radiation therapy might be necessary for cases that have spread or can't be fully removed surgically. Number 3. Melanoma. Melanoma is the most dangerous form of skin cancer, developing in the melanocytes, which are the cells that produce your skin's pigment, called melanin. While it accounts for only about 1% of skin cancer cases, it's responsible for the majority of skin cancer deaths. Melanomas often appear as new, unusual moles or changes in existing ones. Melanoma can develop anywhere on your body, including areas that rarely see sunlight. While UV exposure is a major risk factor, genetics also play a significant role. People with fair skin, multiple moles, or a family history of melanoma face higher risks. Treatment here depends on the stage at diagnosis, but might include surgery, immunotherapy, targeted therapy, or radiation. How to tell the difference between warts and skin cancer. Many people mistake warts for skin cancer because they can look similar, especially in the early stages. However, there are several key differences that can help you tell them apart. Number 1. Growth speed. Warts tend to grow slowly over weeks or months, while skin cancer lesions can appear suddenly and change rapidly. Number 2. Texture and appearance. Warts are typically rough and raised with a bumpy, cauliflower-like texture. Skin cancer, on the other hand, may be smooth, scaly, or shiny and can develop into an open sore. Number 3. Pain and sensation. Warts are usually painless, except for plantar warts on the feet. Skin cancer lesions may itch, bleed, or become tender over time. Number 4. Color and shape. Warts are usually the same color as your skin or slightly darker. Skin cancer spots can be brown, black, red, or even white, often with irregular borders. Number 5. Healing. Warts remain stable for a long time, but don't typically turn into an open wound. Skin cancer lesions may ulcerate, bleed, or fail to heal, even after weeks. Before we continue, if you have been finding the video helpful so far, hit the like button and don't forget to subscribe and hit the bell icon so you don't miss more videos like this. When to seek medical attention. It can be difficult to diagnose skin growths just by looking at them, which is why medical evaluation is crucial. If you have a wart-like growth that has been changing in size, shape, or color, or if it has become painful, bleeding, or not healing, don't wait. Schedule a skin exam immediately. The ABCD rule can also help you identify potential melanomas. This acronym stands for asymmetry, irregular shape, border irregularity, color variation within the same mole, diameter larger than 6 millimeters, and evolving size, shape, or color. Any mole exhibiting these characteristics warrants immediate medical attention. A dermatologist may perform a skin biopsy, removing a small piece of the growth for testing. This is the only way to confirm whether it's a harmless wart or a form of skin cancer. Early detection makes all the difference, as skin cancer is highly treatable in its early stages but can be deadly if ignored. At the end, warts and skin cancer can look similar, but knowing the key differences could literally save your life. Warts are caused by a virus and often go away with treatment, while skin cancer results from uncontrolled cell growth and requires medical intervention. If you ever notice an unusual bump on your skin, especially one that changes, bleeds, or doesn't heal, don't take any chances. Get it checked right away. Now, we want to hear from you. Have you ever had a strange bump or spot on your skin that you weren't sure about? What made you finally decide to get it checked? Or did it go away on its own? Share with us your experiences and opinions in the comments below. We love to hear them. Thanks for watching.